Are you struggling to get a good night's sleep? Or maybe you've heard about melatonin and wondered if it's the right solution for you. In today's video, we'll break down everything you need to know about melatonin, including its benefits, potential side effects, and how to use it safely. Let's get started on your journey to better sleep today. Hello friends, if you're new to the channel, hi, my name is Lindsay Dixon. I'm a pharmacist and an author and now also a YouTuber. And on this channel, we discuss evidence-based health insights that help you to advocate for your own health and live a longer, healthier life. Did you know that 1 in 3 adults worldwide struggle with insomnia? And up to 25% of children also struggle with getting a good night's sleep on a regular basis. The trouble with insomnia is that it becomes this vicious cycle that can really ruin your life quite quickly if not addressed promptly. I've done a few videos on sleep, so in the description of this video, I will give you the link to our sleep playlist with multiple videos that discuss some lesser known causes of fatigue that you should watch, as well as some practical evidence-based tips on how to sleep better. You may know that melatonin is a hormone that is naturally produced by the pineal gland in the brain in response to the presence or absence of daylight. Melatonin also plays a significant role in the body and is instrumental in determining not only when we fall asleep, but its release into the bloodstream also impacts the quality of sleep we experience. We do know that as we age, the quantity of melatonin our body produces tends to decline. In addition, we also know that the habit of smoking is known to reduce blood melatonin levels. So, could taking a melatonin supplement help you sleep better? There are a few things to look at before considering melatonin for insomnia or other sleep-related issues. First, it's essential to rule out other potential causes first. These could include disorders like sleep apnea, restless leg syndrome, medication or substance use, arthritis, menopause, or even gastroesophageal reflux disease, otherwise known as GERD. A sleep diary and sleep tracking can also be useful tools in diagnosing and treating sleep disorders. And there are many of these that you can now use to track your sleep directly on your mobile device. I will list a few of these in the description of this video. Now, if you have ruled out the possibility of other health issues being the cause of your sleep trouble, you probably want to know about the potential benefits and drawbacks of melatonin supplementation. Melatonin supplementation can provide several benefits, such as increasing total sleep time, reducing the time it takes to fall asleep, and even resetting the sleep-wake cycle. It can be particularly helpful in cases of jet lag and for a condition called delayed sleep-wake phase disorder. There is also research showing that melatonin may be more effective than traditional prescription medications for reducing preoperative anxiety in surgical patients. But what about side effects? While melatonin is generally considered safe, it's not without side effects. The most common side effects of melatonin include abdominal cramps, dizziness, drowsiness, headaches, irritability, and even transient depressive symptoms or changes in mood. The good news is that the incidence of these side effects is relatively low, especially with short-term use, say less than 7 days. However, there are still people who are very sensitive to the effects of melatonin supplements and other people who do not tolerate it at all. When it comes to dosage, for adults under the age of 55, a regular release tablet of 0.3 to 5 milligrams, taken about 30 to 60 minutes before bedtime, is the general recommendation. For those over the age of 55, a 2 milligram timed release formulation may be more effective. And again, if you find you're needing to use this for more than 7 days, you should definitely consult with your healthcare provider to make sure that this is safe for you and rule out any other health issues that might be causing your insomnia. When it comes to pregnancy and breastfeeding, the safety information on using melatonin is very limited. So again, ask a healthcare professional before using this supplement if you are pregnant, considering getting pregnant, or are breastfeeding. One key factor to consider before using melatonin is the potential for drug interactions. This refers to how other medications may affect melatonin's effectiveness or how melatonin could alter the effects of those medications. For example, if you are considering a melatonin supplement and are on a particular type of blood pressure medication known as a calcium channel blocker like amlodipine, nifedipine, nicardipine, melatonin is known to decrease the efficacy of these medications, which could result in an increase in blood pressure. Also, people who are on blood thinners like warfarin or those who take medications that lower their blood sugars like insulin, or some medications that are prescribed for type 2 diabetes, should also ask their healthcare provider before supplementing with melatonin, as melatonin may impact the efficacy of these medications as well. We know that melatonin is metabolized in the liver by a group of enzymes known as cytochrome 1A2. Because of this, melatonin should be avoided with strong CYP1A2 inhibitors like fluvoxamine and the antibiotic ciprofloxacin. There are other medications that can increase the rate at which melatonin is metabolized, such as the anti-seizure medication carbamazepine or the antibiotic rifampin. And if this happens, it could decrease the efficacy of your melatonin supplement. So talking with your doctor or pharmacist before supplementing is a way to help avoid the undesirable effects of these drug interactions and to make sure that you are taking a dose that will be most effective for you. Finally, since melatonin is known to cause drowsiness, there can also be additive effects when combined with medications or substances that are classified as central nervous system depressants. This includes alcohol, benzodiazepines, opioids, and other sleep medications. Combining melatonin with these kinds of medications could lead to increased drowsiness and other side effects like confusion, delirium, and even leaving a person at a higher risk of falls when getting up in the middle of the night. So although this is a supplement that is available over the counter, it's not without side effects and the potential for some fairly serious drug interactions. Now, if you'd like to know if melatonin can be used in children, check out this video where I explain the evidence for melatonin use in children. A warning to those who live in the United States. It's important to know that melatonin is not regulated by the FDA. A recent study in the journal JAMA found that some melatonin gummies had dangerously high levels of the hormone, while others didn't contain any melatonin at all, and instead they were filled with CBD. This makes it crucial to choose your melatonin products carefully. Also, if you're considering melatonin, it's best to avoid alcohol close to bedtime for it to work optimally. Many people believe that alcohol helps with sleep, but this is a common misconception. And while alcohol might make you feel drowsy at first, it actually disrupts the natural sleep cycle, preventing you from reaching the most restorative sleep stages. It also reduces melatonin's effectiveness. Finally, whether you are using a sleep supplement like melatonin or not, it's absolutely essential to implement the sleep hygiene practices that I outline in this video. And if you're still struggling to get a good night of sleep, there is actually high-quality scientific evidence now showing that good sleep hygiene combined with cognitive behavioral therapy for insomnia is often a more effective long-term solution for insomnia than medication alone. Thank you for watching, and if you found this video helpful, please share it with a friend and check out the resources I've listed in the video description. And don't forget to like and subscribe for more content like this in the future. Take care and stay healthy, and I'll see you in the next video. Bye-bye.